Welcome to our special NRI show, Ask Your Doctor. I'm your host, Shivani Raj. Today, we have Dr. Purvi Parikh, MD. She is an allergist and immunologist at Allergy and Asthma Associates of Murray Hill. She is currently on faculty as clinical assistant professor in both departments of medicine and pediatrics at New York University School of Medicine. Dr. Parikh has published articles in allergy, asthma, and immunodeficiency syndromes in various peer-reviewed journals and textbooks. She is also a national spokesman for the Allergy and Asthma Network, which is the leading patient advocacy group for patients and their families who suffer from life-threatening allergic and immunologic conditions. So, without any further delay, let's welcome her on our show. Hello, doctor. I hope you're doing really well. Thank you so much for coming on to our show today.
Yes, thank you so much for having me.
Yes, doctor. So I was hoping if you could introduce a little about yourself and what you do.
Yeah, so, I'm an allergist and immunologist. I practice in New York City. I treat both children and adults, and I treat people with a whole variety of allergies. So environmental allergies, food allergies, asthma, medication allergies, and I also treat rare immune system disorders. So people born without functioning immune systems. And recently, in the last 2 years, in the COVID pandemic, I have become very involved with all of the COVID-19 vaccine research, as well as the COVID long haul research, so the long-term complications of COVID-19.
Yes. So doctor, let's start with today's topic. Can you give a basic introduction about what exactly are allergies?
Yeah, so allergies are basically an overreaction of your immune system. So our immune system usually helps us, right, by fighting infections and keeping things out that should not come into our bodies. However, when somebody develops an allergy, that means their immune system is fighting something it should not be. So that means your immune system has become too sensitive or overreactive to something. So that can be environmental, like pollen or dust mites or mold or animals. It can be a food, like peanuts, milk, eggs, wheat, or even a medication. And it's important to know if you have a true allergy, because in some cases it can be very dangerous and life-threatening.
So doctor, I was hoping if you could tell us what are some different types of common allergies that are in the world.
Yeah, the most common types are environmental allergies. There's millions, if not billions now globally that suffer from these. And these are allergies to things that are in the air. So airborne allergies, such as different pollens that different plants may give off in different regions, dust mites, mold, which is, a fungus that can grow either indoors or outdoors. And many people have allergies to their pets or to animals, so such as cats or dogs, or, if you're a farmer or someone who might be raising horses and other animals, you can become allergic to those things. And these allergies can be very serious because they can cause asthma, which is a breathing condition where your lungs have a lot of inflammation and it can be difficult to breathe. And these allergies are the most common cause of these lung disorders. So that's probably the most common. And then food allergies are becoming more common now. In the last 2-3 decades, actually, it's nearly doubled in children, the amount of food allergies we see. And these are usually very dangerous because they can cause a life-threatening reaction called anaphylaxis or anaphylactic shock. And the most common foods that cause these type of allergies are peanuts, milk, tree nuts, soy, wheat, fish, and shellfish. So it's very, again, important to know if you truly have this allergy or not. And then some patients and some people may even develop allergies to certain medications too.
Yes. So doctor, I was hoping, how are allergies diagnosed? I'm sure there are different kinds of allergies, of course, like you just said. How are they diagnosed? Do we have any specific tests or, any reaction that is supposed to let us know that we have an allergy to a specific thing?
Yeah, so, if you're suspicious you might be allergic, it's good to go see, a doctor or physician who specializes in allergies, because there are tests so we can identify what you are allergic to. So there's a skin test as well as a blood test. that can tell us what food or environmental things that you might be allergic to, and then in some cases medications as well. Because what it measures is there's an abnormal antibody that your immune system makes called IgE, like elephant. And usually if somebody is allergic, that is too high, and it's too high for a specific item. So we can measure that either by pricking someone's skin with different allergens and then seeing if they will have a small reaction in their skin, or through checking blood work. And often, if you think you might have an allergy, some of the common symptoms might be rash or itchy skin, coughing, wheezing, chest tightness, nausea, vomiting, stuffy nose, itchy, watery eyes. These are all common symptoms that might prompt you to go see a doctor to be tested.
Yes. So doctor was hoping if you could tell us what are the 4 types of allergic reactions?
Yeah, so there's 4 different types. Type 1 is called the immediate hypersensitivity reaction. And just like the name, it happens very quickly. And this is the majority of allergic reactions. The type 1 or the immediate allergic reaction is also can be very, very deadly too. That's that anaphylactic shock that we always hear about. So it can be mild symptoms, just like itching or itchy, watery eyes, stuffy nose, rashes, or it can progress to more serious symptoms like breathing problems, loss of consciousness, vomiting, so swelling of your lips or tongue. And this is a type 1 immediate hypersensitivity reaction. So that's usually things such as foods have type 1 reactions, although some may have more delayed reactions. Environmental things like those airborne allergens that I mentioned, and even a lot of medications can have it too. So what immediate means is that you will have the reaction within at least 30 minutes to 60 minutes of being exposed to the allergen. Then there are other types of allergic reactions that are a little bit different. They may be a little bit more delayed. So a type 4 reaction is what we call a delayed hypersensitivity reaction. And common examples of that can be certain rashes like contact allergies, eczema or atopic dermatitis is an example of a delayed allergic reaction. Poison ivy or poison oak, allergies to certain plants can be delayed allergic reactions. So basically what happens there is something that you may have been exposed to 48 hours ago, 72 hours ago is now causing the rash today. And then a type 2 reaction is when your body forms different type of antibodies. So we see this a lot with different medications. Certain things like heparin can cause a type 2 reaction because it causes other problems within your body, such as your platelets to drop. And in type 3, your own immune system starts forming what we call complexes. And this can, again, affect multiple organs. And type 2 and type 3 are a little bit more challenging to diagnose. Type 3, a common one is something called serum sickness. So it's a little bit different than your typical allergic reaction. You can have swelling and rash, but you also might have fever. You might actually look like you have an infection or a cold, but it's actually not. It's actually an allergy. So the type 2 and 3 are different types of immune reactions, and it's important to determine what exactly you have.
Yes. I'm sure the question that I'm going to ask you now is very common, but even this happens to everybody, or let's just say me. I sometimes I get closer to dust, and sometimes I get really confused. Do I have an allergy with dust, or is it just a cold? So how can one differentiate between an allergy and a cold?
Yeah, that's a very common question. You're correct. So usually with allergies, the symptoms will last much longer than a cold. So allergies, there's a pattern. So like you mentioned, if it happens every time you're around dust, or it happens all the time in the spring or the fall or certain seasons, probably it's an allergy. Also, usually allergies may last for weeks, so if you notice same time every year you get sick for weeks and weeks, it's probably not a cold, it's probably an allergy. The other way to tell the difference is usually colds and viruses will have much higher temperature. So you'll get a fever of 100.4 or higher, or at least 100 degrees or higher for infections like colds and viruses. And they come on very quickly, and it's much more short term. So a cold or virus might be, 3 to 5 to even 10 days. But, like I mentioned, allergies will be much longer. They won't have high body temperatures associated with it. Also, allergies have more itching symptoms. So you might have itchy eyes, itchy throat, itchy ears. But, a lot of the symptoms are almost identical. So it can be difficult. Like nasal congestion is the same, cough is the same. Believe it or not, sore throat can happen with both allergies and a cold, headache. Usually with a cold, though, you might have full body aches, which isn't common with allergies. And you might have stomach disturbances like vomiting, diarrhea, things like that don't often happen with the airborne allergies. That can happen with some of the others, but that won't happen with stuff like dust or dust mites or mold or pollen. But again, remember, some of the symptoms are very hard to tell. So if you're not sure, it's very easy. You can go in and be tested and see if it's a virus like flu or coronavirus or something else, a bacterial infection or an allergy.
Yes. Doctor, I'm sure the question that I'm going to ask you now is going to shock a lot of people watching. But a lot of, let's just say about our very own country, India. In India, every day people drink milk. I'm sure like they drink milk, ghee. There's a lot of dairy intake that takes place on a daily basis. And unfortunately, a lot of people don't know that some can be allergic, and they will not know themselves. So can you tell us how some can be allergic to dairy and still not know?
Yeah, that's actually a very good question, because I think many confuse what allergy actually means, right? So if you're eating and drinking dairy on a daily basis and nothing is wrong, meaning you don't feel any different, then you're not allergic. Your own body is the best indicator of if you're allergic or not. Now, many people confuse a dairy allergy with something called lactose intolerance, which actually is not an allergy. It's a digestive problem. And what that is basically that some people genetically lack the enzyme to properly digest lactose. So they might get upset stomach, diarrhea, and they can't tolerate certain forms of dairy, so they might be able to eat yogurt or cheese, but they can't drink like whole milk, so that's not an allergy. If you were truly allergic, you would be unable to tolerate it in any form. So majority of allergies involve the skin in some way. So it's either itching or rash or swelling of your skin or lips or tongue. And it also may be accompanied by trouble breathing or vomiting, but there has to be a skin symptom in at least 90%, and it's important to differentiate if it's a true allergy or not, because in a real allergy, you can't have it at all. It can be life-threatening, and you need to carry emergency medicine with you, like an epinephrine pen. But majority of people actually are not allergic. They are just intolerant, meaning they have digestive problems, and meaning it's not life-threatening if they eat it or drink it, but it's very uncomfortable. And if they have that issue, there are also certain aids that they can take to help them digest the food. So they can actually take that enzyme and they can work with the stomach, with their doctor or a gastroenterology doctor to help them out. The good news is the majority of dairy allergies are in children. So it's very rare for an adult to have a dairy allergy. And even those kids with the real dairy allergy, 90% outgrow it. So that's also good news, So luckily it's not very common, but, you may have that dairy intolerance or lactose intolerance.
Yes. So doctor, when I was discussing that we were going to have this topic with my friends, a lot of other common question that they had is acne related to allergies? Is skin care or bad skin related to allergies? What is your view on this?
Yeah, so there's a big misconception. Not all skin rashes are allergies. So acne, believe it or not, is not related to allergies. Acne is more hormonal, so that it has a different cause. So your allergies usually won't cause acne. The other thing that's not related, a lot of people think either rosacea or, as you mentioned, bad skin may be related to allergies, and it's not. These are different mechanisms, but there are some rashes that are related to allergies. So if you suffer from eczema, which is very dry, itchy, red, flaky skin, that can be an allergy. And that can be triggered by foods, especially in really young children. Or in adults, it's more likely to be an environmental allergen or an ingredient, a chemical ingredient that you might have become allergic to, even if it's a product that you've been using for many years, or something like latex. And psoriasis, also many people think are linked to allergies, but this is not an allergy. This is actually an autoimmune disease that's managed in a very different way. Hives, though, which are like raised mosquito bite type rash, that actually can be an allergy. So one way to kind of decide, is this an allergic rash or a non-allergic rash, is whether it itches, because the itching is a good sign that it's an allergy. Or if it's very red, it's a good sign it's an allergy. But many rashes are not allergies, and they're caused by a whole variety of other factors.
So doctor, which plants are worse for allergies, and also is stress related to allergies, and are stress and allergies linked in any way?
Yeah, so those are great questions. So, stress doesn't necessarily cause allergies, but it can make allergies worse. Just like stress can make any medical condition much worse. So if you're already suffering an allergic reaction, or you're already having some type of allergies, if you're stressed, it will be much, much worse. So the reaction will be amplified. Other things that can make allergic reactions worse, even, nasal eye allergies, is alcohol, stress, believe it or not, like certain weather, like severe hot temperature, that can also make allergies worse. And other things, certain foods, not foods, but certain medications can also trigger allergies. So like Advil, Motrin, those type of things can make allergies worse. Exercise, any temporary stress on the body can make any allergic reaction that you're having worse. So that's why it's important to kind of get it under control and to manage stress as best that you can. And I think you asked about the plants. It really depends of where in the world that you live. So some places have a lot of plants that produce pollen. And so some of the most common pollens that people suffer from are ragweed pollen, tree pollen, like trees give off pollen, grasses give off pollen, certain weeds. But then each country in each area of the world has different vegetation, different plants. So they have different pollens, and the treatment varies. So for example, in Greece, the olive tree pollen causes a lot of allergies. So luckily in places like India, South Asia, South America, those type of allergies usually are not as common. Now they're becoming more common as these countries become more industrialized and globalized, because air pollution and air quality can make allergies worse. But I see a lot of patients that never developed allergies until they moved to the US, because often in South Asia and South Africa, your immune systems actually are in a better state because you're exposed to other organisms and bacteria that are actually good for you. And it actually builds up your microbiome and protects you from allergies and autoimmune diseases. So it is much worse in the Western world.
Yes. So doctor, let's get into another topic, that is asthma. So can you explain us what exactly is asthma, and how does inflammation of the airways affect one's asthma?
Yeah, so asthma is most commonly, it can be triggered by many things, but the most common cause is allergies. So what happens is the inside of your breathing tube, everyone has a breathing tube, when it comes in contact with something you're allergic to, it can build a lot of mucus and become swollen. And because of that, it becomes very hard to breathe. It's almost like breathing through a thin straw. So allergies can trigger this reaction where the muscle inside your airways starts spasming and all this mucus is building up. Viruses can cause this, any infection. And in some individuals, even things like exercise or temperature changes can cause asthma. So it's very important because asthma actually can be deadly. In the US, for example, we have 10 people die from asthma on a daily basis, even before the pandemic. And this is a very preventable disease, especially if you are on the correct medication. It's very easy to treat and manage. So if you think you might have asthma, please go and see a physician and make sure you get on the right medications, because it's dangerous to keep breathing with the mucus and narrowed airways. And common signs and symptoms of that are coughing, wheezing, chest tightness, shortness of breath. These are all signs that you might have asthma.
Yes. So doctor, what exactly causes asthma and what triggers it?
Yeah, so the most common triggers again are allergies. That's most common. So dust, mold, pollen, dust mite, animals, if you're sensitive to it, viruses, like flu, COVID can trigger it, any virus, drastic changes in temperature. So whether it's too hot or too cold, and, in some individuals, exercise. Exercise can trigger asthma as well.
Yes. So doctor, according to you, what is asthma? Like, is it a curable disease or it's going to be a lifelong disease?
Yeah, so there's no cure for asthma, but it's very manageable. So there are many people who are highly functioning, like 10% of Olympic athletes actually have asthma. It's very, very common. And in the US, 25 million people have asthma. Globally, billions have it, So just because it's not curable does not mean it's going to ruin your life. So as long as you're on appropriate medicines to prevent an asthma attack, and as long as you are empowered and know your triggers, you'll be in very good shape and you'll live a very long, healthy life and able to be very active. And now we have a lot of treatments actually meant for asthma. So we can really personalize the approach. And by making you less allergic, so we actually give people allergy shots and desensitize them so they stop being so allergic. Some people's asthma gets much better and even goes away because we're eliminating that trigger. So even though there's no quote unquote cure, there's so much you can do to make it very manageable and almost non-existent if you are proactive.
Yes. So doctor, how can one avoid common triggers of asthma, and is there any way one can make their environment at their home better, especially if they have asthma?
Yeah, so in your home, the bedroom is the most important room because all of us spend the most time there. So you want to keep that room the cleanest, but if you keep your whole house clean, it's good. It's good to get rid of rugs and carpeting because that can collect dust mites and mold and dust in it. It's easier to clean without rug and carpeting. It's good to get special covers, allergy covers for your mattress and box spring and pillows. That will prevent you from breathing it in while you're sleeping. And then finally, air purifiers. HEPA air purifiers can help keep the air quality good inside of your home and prevent asthma and allergy symptoms.
Yes. So doctor, can people with asthma work out? I mean, if yes, what kind of workouts can they do or what are they limited to? And if no, please share your views.
So if your asthma is well controlled, meaning you take your medicine regularly, you avoid your triggers, you can do any type of workout. We have Olympic gold medal winners with asthma. 10% of Olympic athletes are asthmatics, professional athletes, so it doesn't have to limit you. But if your asthma is uncontrolled, any workout is dangerous, even something low impact like yoga or walking. So that's why it's so important to see your doctor and make sure that you're on the correct medicine, because with the right medicine, the sky is the limit.
Yes. So doctor, another common question about allergies is that I've seen people with allergies, and I've personally seen people with allergies that they've had allergies when they were a kid, and as they grew up, the allergy was not that bad or it was actually not there. So do you think this happens, one can outgrow from their allergy?
Yeah, it is common that it depends. Not everybody outgrows it, but commonly boys are more likely than women to outgrow it. As well as, it depends. Some girls do because puberty, sometimes girls get worse after puberty and some boys outgrow it. So it is possible. And as I mentioned, many children can outgrow their milk allergies.
Thank you, doctor, for coming on to our show today. It was wonderful having you. We covered so many different topics. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.